Clinical trials are a wonderful opportunity to determine whether a new compound, a new chemical, is going to be effective in treating the condition, or whether the compound is not going to be effective as such. But it is demanding on the patient population. They have to comply with the conditions under which the clinical trial is conducted. We have criteria that we use to include patients. We have criteria that we use to exclude some patients, because the clinical trials often are pretty demanding. They're very rigorous in the way in which they're designed. We very much depend on the patients to comply with all the requirements of the clinical trial. They truly have to work with us as clinical investigators to maximize the opportunity, to minimize the time it takes to start the study, to end the study, and to reach a conclusion after analyzing the data as to whether the agent being tested is effective or not effective as such. On the one hand, it's a wonderful opportunity for the patients to participate with the clinical investigators. On the other hand, it does take a certain amount of their time. If the study is not totally funded, sometimes it even requires that they take time off from their work. The children take time off from school. They may end up having to cover the cost of traveling back and forth to the institution or parking. We like to defray all those costs if we can, but in these economic times it's sometimes difficult to cover all of the costs involved, but we do the best we can to ensure that there's essentially no financial burden imposed upon the family and the patient for participating. But it's a demanding process. I don't want to minimize what it all represents, but it is the only way to finally identify an effective treatment for this disease.